Hi, good afternoon. I'm Lisa Masarwe. I am the Senior Vice President and Chief Nursing Officer, and I am joined today with Chris Cruchet.
Hi, I'm Chris Cruchet. I'm the Senior Vice President and Chief Information Officer for the system.
And we're bringing you the update today, so thank you for having us. And we'll start with the COVID numbers. So currently there are 904 COVID cases in the state. When we look at the capital region, 51 in the capital region, so going down in numbers, which is a good progression. We'd like to see that direction. We have about 20 in our hospital as of today. And if we look at the graphs that you'll see up, you'll see that really the vaccine has shown really great effectiveness in terms of decreasing the transmissibility, so that trend continues. And when we pop up the graph that shows us the different strains of the COVID vaccine, it's really the BA.2 variant that seems to be leading the way. So really interesting. We continue to keep our eye on that and continue to follow all of the guidelines to keep each other safe. Chris, I know you wanted to talk to us a little bit about some of the upcoming events with the EMR, ERP. So what's going on in that front?
Yeah, thanks, Lisa. So I hope everybody knows by now that we're implementing two very significant platforms for the system: our ERP, which is our Enterprise Resource Planning System, and our EMR, which is our electronic medical record. And those really don't give it the breadth of everything that those two applications will do for us as a hospital and us as a system. So the first thing is just to mention the names. Hopefully you've heard our ERP system is Workday, and our EMR system is Epic. Two of the most prolific applications that are in our market that are used for healthcare. If you look across the healthcare systems, the academics, the communities, most of them use these two systems for everything that we're looking at for. Two items. One is timeline. So people have been asking, when are we doing this? There's a lot of things going on in the background right now, but to give broad time frames, our ERP system should be live sometime in mid-2023. So sometime next year. The teams are working very actively. They're already in the planning phases. They've already kicked that off, a very broad team there. The EMR is going to take a little longer by plan. We are hoping that by the beginning to mid of 2024, we'll be live on Epic here at the medical center. And then probably about 6 months later to plan, we'll go live in Columbia, Saratoga, and Glens Falls. All very big applications, all very, very big deployments. A couple of things that have been going on in the last 3 months. A lot of people involved in the background doing what we're calling governance and governance alignment with all of the 4 hospitals. So we've had 2 consultants that we've hired for the system, really to talk about how do we operate as a system? How do we take 4 hospitals and apply everything that we need to do for the ERP and the EMR and really act as a system? A lot of back-end decisions are going into it, a lot of big decisions regarding, let's say, finance and supply chain and HR, and then on the clinical side, all the things that go into that, whether it's patient engagement, whether it's how we care for people, how we document. So all of those back-end decisions are getting discussed right now at the executive level and at the leadership level. Aside from that, we're in what's called alignment sessions. So for the last couple of months, we've had about 1,000 people involved in almost 500 different meetings across the center and across the system. And those alignment sessions are really to get people talking that have never talked before across the 4 hospitals about what they do. We're not talking about the deep workflow that many of our work teams will be involved in, but we're really talking about how are things done at each hospital at a high level. And we're trying to get people to, number one, understand each other, and then number 2, come up with some ways that we can kind of look at aligning those pieces and aligning all the things that we operate with, and even down to the application level. How do we do that in one coordinated fashion? So those alignment sessions are going on right now. We'll continue working that for the next month or so with an understanding that we're probably looking at a July to August kickoff, a broad kickoff of the project. And that's where we're at, Lisa.
That's great. That's great. Really exciting news for us and for us as a system as well. So it will advance patient care undoubtedly. Thank you. Some good news going on. So our Women and Children's Hospital was just alerted that our multidisciplinary collaborative teams were awarded the OB Hemorrhage Quality Improvement Award for 2021. So big shout out to the physicians, the nurses, the whole care team that has made that possible and is saving lives through that initiative. So really good news. And then we had a DAISY Award winner, Angelique Sanderson from our Medical Oncology Unit was honored this week with DAISY Award. And Angelique was nominated by a patient's spouse who wrote about her, "The nursing care she delivered exemplifies the art and the science of nursing. Angelique worked tirelessly to manage her husband's complex nursing care needs, to keep him comfortable, all the while treating him with compassion, kindness, and dignity." The patient's spouse continued to say that Angelique helped coordinate a visit with their children from out of town so that they could see their father in his final days of life. There's nothing we asked for that was too little or too large for Angelique, and she always did it with a smile on her face. So thank you, Angelique. That really is the heart of nursing, and you've touched many, many lives with that. Thank you. Update in terms of some of the events going on in campus. We are going to hold some yoga sessions in the BE entrance. There's a schedule posted on the intranet site. Some of them are over the lunch hour, so if you can break away, take care of mind, body, spirit, get some flexibility in, that's awesome. So that's our update for this week. We really want to thank you for all you do each and every day. We'll see you out there as we're out and about. Thank you.
And so much more coming on the ERP and the EMR. A lot of activities for the next year, year and a half, and we'll be seeing you there.
Take good care of each other. Take good care of yourselves.
Thank you.